America's healthcare system is so broken that every year, hundreds of thousands of people are literally asking for donations to afford medical treatment. GoFundMe has helped Americans pay for billions of dollars in medical bills. Leah Butler is one of them.
If you see I got the final notice, that means, girl, pay up, but I'm not.
Leah has thousands in medical debt because her 3-year-old daughter, Alea, requires round-the-clock care. And the shocking thing is, Leah has medical insurance.
Private insurance has got to go.
So, is GoFundMe actually helping Americans avoid medical debt? Or is there a better way to do healthcare in this country? If you visit GoFundMe.com's medical page, you'll see this quote: "You can get immediate help with medical bills." Scroll down farther, and GoFundMe calls itself the leader in online medical fundraising. The site hosts hundreds of thousands of medical campaigns each year. You might even come across this one. Last year, Alea suffered a seizure and heart attack, which left her brain damaged.
The way Alea was before the incident, Alea was funny. She'd make you smile. She was loving. She was bossy. You gonna make me cry, girl. She was just everything. Like, that was my best friend.
After she used up all her savings, Leah started a GoFundMe to help offset some of her daughter's recovery expenses. But that's not why Brad Damphouse and Andrew Ballister started GoFundMe. It was supposed to be for festive occasions, like vacations and weddings. In the year GoFundMe launched, just 42 campaigns on the site were healthcare related. By 2018, that number skyrocketed to over 100,000.
There needs to be a real look at why there is such an expectation for patients to pay so much of their own means towards their medical care.
From 2016 to 2020, medical GoFundMe campaigns in the US raised more than $2 billion from donations. According to one study, cancer was the medical condition most fundraised for, while trauma and injury were second. But Americans aren't going to GoFundMe just to raise money for rare disease treatment or even medical emergencies. They're also starting campaigns to pay for routine care.
Not only do we have the medical debt, it's the co-pays. You know, like every other week she's at a specialist. So I'm paying 30 here, 30 there, 30 there, 40 here, 30 there, 30 there. That adds up. So that's where the GoFundMe come in at, to just help me cover them rusty ends that I can't meet.
Following emergency room visits, research shows that co-pays to see your doctor, childbirth, dental care, and lab tests are among the leading causes of medical debt. If Alea was born in any other industrialized country, her mom probably wouldn't have to ask for donations to pay for her treatment. So where did it all go wrong? For starters, unlike many countries, the United States does not see healthcare as a human right. That's why it's the only upper-income country without universal healthcare, a system designed to guarantee coverage for everyone while keeping costs down. Healthcare in the U.S. is based on a mostly private insurance system. Like any business, their main objective is to profit, which has a domino effect on the price of healthcare, driving costs up. And although employers subsidize some insurance coverage,
that cost gets pushed increasingly down to the individual who's trying to get the care.
In 2017, about 34% of healthcare costs, more than $800 billion, didn't even go toward treatment. They were actually covering the administrative costs of insurance companies. Now, here's something you might not know. In the US, patients are charged for each service they receive. This is called fee-for-service healthcare. Take a look at this medical bill. If you stay overnight in the emergency room, you won't just be charged for the visit. You'll also be charged a fee for every service provided. This could be $90 for morphine, $722 for IV pushes, and $6.50 for a pill. Or if you just gave birth, $40 to hold your newborn. Yeah, that's a thing. More than 80% of primary care doctors and more than 90% of specialists in the US are actually compensated based on the volume of services they provide. This means they're incentivized to overprescribe and sometimes provide unnecessary services to patients rather than helping them get healthier. In short, the more procedures providers deliver, the more money they make. But that equates to a larger bill for you.
That is an untenable situation that we have got to address. And that, to me, is where we are always focused. What is the impact on the patient, and what changes can we make to ensure that the patient isn't shelling out so much out of their own pocket in order to get basic healthcare needs met?
And lastly, healthcare is so expensive because the government doesn't regulate it. The US government has no control over what hospital systems and pharmaceutical companies charge for their services, including care, insurance, or drugs. There's another reason Alea's mom was more likely to need help on GoFundMe. 28% of Black households and 22% of Latino households have medical debt, in comparison to 17% of white households and 10% of Asian ones. This gap is even wider when you factor in location. In places like St. Louis County, Missouri, that percentage quadrupled for communities of color compared to white communities. So it's a good thing that Americans have GoFundMe to help them get out of this nightmare, right?
GoFundMe does not work to solve people's medical debt problems. It helps some individuals, but it doesn't help the vast majority.
Take Mississippi, for example. The state's population has the highest percentage of medical debt, and it has one of the highest percentages of uninsured individuals. And yet, GoFundMe health campaigns from Mississippi have raised less money than campaigns from any other state. That's a pattern repeated across the country. People in states with higher medical debt, lower insurance, and lower incomes receive less money than those in states with lower debt, higher insurance levels, and higher incomes. So while GoFundMe may help, it isn't leveling the playing field.
So when I first started the GoFundMe, my initial goal was $10,000 because I was thinking about the things we needed right then and there. I initially made $3,000, and I took the $3,000 and got her the van that she needed to take her to therapy and get her back and forth to all her appointments.
Leah's campaign has raised close to $7,000.
But I thank God for just being able to have a little funds to where the GoFundMe. It helped me out a lot.
But not everyone is as fortunate with hitting their fundraiser goal. When it comes to the overall success of medical campaigns on GoFundMe, 16% of them raised nothing, while 90% failed to meet their goal in 2020. Many of the people behind these desperate campaigns end up bankrupt. Unsurprisingly, medical debt is the #1 cause of bankruptcy in the United States. And once the medical debt goes into collection
agencies take a variety of actions, as do hospitals, to collect their debt. It could be anything from garnishing someone's wages, going after their home, going after their car. It could just be harassing phone calls.
In April, the White House announced measures it would take to help ease medical debt for Americans, like informing consumers of their rights and making medical debt forgiveness for veterans more accessible. And starting in July 2022, the 3 largest credit bureaus will remove paid medical debts from credit reports.
So these are solid changes in the right direction, but I also want to be clear that it is not enough in and of itself.
The small changes we see happening now are thanks to decades of grassroots efforts to push politicians to address the root cause of medical debt, the U.S. not having universal health care. But will this become a reality anytime soon?
There's a lot of calls appropriately for, should there be a single payer system? Should there be universal health care? I don't frankly see the politics lining up for that. And so I want to see changes that are going to happen immediately.
Allison believes the first thing that needs to change is insurance.
People are feeling like they have an insurance plan that they're paying a lot for a premium on, and then what they're getting for it is something they can't actually afford, and that should not be allowed.
I just really think that the government is really plucking us. That's the word I'll use. It's plucking us because I really think we deserve more as citizens and as taxpayers. We deserve help.